Understanding legal responsibilities in nursing practice. Understanding legal responsibilities. Legal responsibilities in nursing encompass obligations that nurses must follow under laws, regulations, and ethical standards to protect patients, healthcare workers, and institutions. Definition: obligations nurses must follow under laws, regulations, and ethical standards. Key areas: scope of practice, patient rights advocacy, documentation and reporting, confidentiality protection. Purpose: protects patients while ensuring professional accountability and safety. Foundation: based on federal and state laws governing healthcare practice. Key nursing laws and regulations. Several important laws and regulations govern nursing practice and define professional responsibilities. Nurse Practice Act, NPA, defines scope of practice for licensed practical nurses in each state. Establishes licensing requirements and professional standards. Varies by state, requiring nurses to know local regulations. Health Insurance Portability and Accountability Act, HIPAA, protects patient privacy and confidentiality of health information. Establishes penalties for unauthorized disclosure of patient information. Requires specific procedures for handling and sharing patient data. Patient Self-Determination Act, PSDA, covers advance directives and informed consent requirements. Ensures patients receive information about their healthcare rights. Supports patient autonomy in medical decision-making. Good Samaritan laws. Protect nurses providing emergency care outside work settings. Encourage healthcare professionals to assist in emergency situations. Provide legal protection when care is provided in good faith. Mandatory reporting laws. Require reporting of suspected abuse, neglect, and communicable diseases. Protect vulnerable populations including children and elderly individuals. Override normal confidentiality requirements in specific situations. Scope of practice for licensed practical nurses. The Nurse Practice Act in each state defines what licensed practical nurses can and cannot do legally. LPNs can perform direct patient care under RN or physician supervision. Medication administration with certain limitations based on state law. Data collection and reporting to supervising nurses and physicians. Wound care, tube feedings, and basic nursing procedures. Patient monitoring and documentation of care provided. LPNs cannot perform independent nursing assessments or diagnoses. Development of nursing care plans without supervision. Administration of 4 medications without special certification in most states. Patient teaching that requires advanced clinical judgment. Supervision of other licensed practical nurses in most states. State variations. Scope of practice varies significantly between different states. Some states allow expanded roles with additional certification. Nurses must understand and comply with their specific state requirements. Patient rights and legal protections. Patients possess specific legal rights that nurses must understand, respect, and actively protect. Right to informed consent. Patients must receive complete, clear information before treatments. Includes understanding of risks, benefits, and alternative options. Must be voluntary without coercion or undue pressure. Right to refuse treatment. Patients can legally refuse care even if it may harm them. Must be informed of consequences of refusing treatment. Requires documentation of refusal and education provided. Right to privacy and confidentiality. Health information must remain secure and protected from unauthorized access. Governed by HIPAA regulations with specific requirements. Includes verbal, written, and electronic information sharing. Right to safe environment. Freedom from abuse, neglect, and unsafe conditions. Includes physical and psychological safety measures. Requires prompt reporting of any safety concerns or violations. Common legal issues and prevention. Understanding frequent legal problems helps nurses implement prevention strategies and protect themselves professionally. Medication errors. Double-check the 5 rights of medication administration consistently. Verify patient identity, medication, dose, route, and timing. Report errors immediately according to facility policies. Document incidents accurately and completely. Documentation failures. Remember that undocumented care is legally considered as not provided. Maintain accurate, timely, and objective documentation. Never alter records after completion or falsify information. Use proper procedures for correcting documentation errors. Patient falls and injuries. Follow fall prevention protocols consistently with all patients. Assess fall risk factors and implement appropriate safety measures. Maintain environmental safety and equipment functionality. Document all incidents and preventive measures taken. Negligence and malpractice. Always follow facility policies and established standards of care. Maintain competency through continuing education and training. Practice within scope of practice as defined by state law. Seek guidance when unsure about appropriate actions. Nurse liability and malpractice. Understanding malpractice and negligence helps nurses recognize their legal responsibilities and potential consequences. Malpractice definition. Professional negligence that results in patient harm or injury. Failure to meet the standard of care expected of competent nurses. Must include duty, breach of duty, harm, and causation. Elements of malpractice. Duty to patient, legal responsibility to provide appropriate care. Breach of duty, failing to meet accepted standards of nursing care. Harm or injury, patient suffers actual damage or adverse outcome. Causation, the breach directly caused or contributed to patient harm. Prevention strategies. Follow evidence-based practice and facility policies consistently. Maintain clear, accurate documentation of all patient interactions. Communicate effectively with patients and healthcare team members. Stay within defined scope of practice and seek guidance when needed. Keep professional knowledge and skills current through continuing education. Documentation as legal protection. Proper documentation serves as both a communication tool and legal protection for nursing professionals. Legal documentation requirements. Must be accurate, timely, objective, and factual. Should avoid opinions, judgments, or subjective interpretations. Must be legible if handwritten or properly entered if electronic. Requires appropriate signatures, dates, and professional credentials. Documentation best practices. Record care provided immediately after completion when possible. Use objective language describing what was observed or done. Include patient responses to treatments and interventions. Document patient education provided and patient understanding demonstrated. Never alter completed records or add late entries without proper procedures. Legal protection benefits. Provides evidence of appropriate care provided to patients. Demonstrates adherence to professional standards and facility policies. Protects nurses from false accusations or malpractice claims. Supports continuity of care among healthcare team members. Mandatory reporting requirements. Nurses have legal obligations to report certain situations even when it may conflict with normal confidentiality requirements. Required reporting situations. Suspected child abuse or neglect by parents or caregivers. Elder abuse or exploitation of vulnerable adults. Certain infectious diseases as required by public health authorities. Gunshot wounds, domestic violence, and suspicious injuries. Unsafe practices by other healthcare workers or professionals. Reporting procedures. Follow facility policies and state laws for reporting requirements. Contact appropriate authorities such as Child Protective Services or Adult Protective Services. Document reported concerns accurately in patient records. Cooperate with investigations while maintaining patient confidentiality as appropriate. Seek guidance from supervisors or legal counsel when uncertain. Legal consequences. Failure to report required situations can result in legal liability. May face professional disciplinary action from state nursing boards. Could result in civil or criminal charges depending on circumstances. HIPAA and confidentiality legal requirements. HIPAA establishes comprehensive legal requirements for protecting patient health information in all healthcare settings. HIPAA protections. Covers all identifiable patient health information in any format. Requires specific authorization for most information sharing. Establishes patient rights regarding their health information. Provides penalties for violations ranging from fines to criminal charges. Nursing responsibilities. Keep medical records and patient information secure at all times. Avoid discussing patient details in public areas or inappropriate settings. Access only patient information necessary for direct care responsibilities. Use encrypted communication methods for sharing patient data electronically. Report suspected privacy violations immediately to appropriate authorities. Violation consequences. Civil penalties ranging from thousands to millions of dollars. Criminal charges for intentional violations or identity theft. Employment termination and professional license suspension. Civil lawsuits from affected patients and their families. Informed consent and legal compliance. Nurses play important supporting roles in informed consent processes while understanding their legal limitations and responsibilities. Legal elements of informed consent. Patient must understand procedures, risks, benefits, and alternatives. Decision must be voluntary without coercion or undue pressure. Patient must be mentally competent to make healthcare decisions. Consent must be documented properly in medical records. Nursing role in consent. Verify that patients understand procedures before signing consent forms. Ensure consent is voluntary and not obtained through pressure. Act as witness to patients' signatures when appropriate. Report concerns about patient understanding or competency to providers. Support patients through decision-making processes. Legal limitations. Nurses cannot obtain informed consent on behalf of physicians. Cannot explain risks and benefits of procedures outside scope of practice. Must not pressure patients to consent to treatments or procedures. Should not provide medical advice beyond nursing expertise. Good Samaritan laws and emergency care. Good Samaritan laws provide legal protection for nurses who provide emergency care outside their normal work environment. Legal protection coverage. Applies when nurses provide emergency care voluntarily. Covers care provided in good faith without expectation of payment. Protects against liability for ordinary negligence during emergency care. Does not protect against gross negligence or intentional misconduct. Requirements for protection. Care must be provided voluntarily without legal obligation. Must act within reasonable scope of nursing knowledge and skills. Cannot be grossly negligent or reckless in providing care. Must not have pre-existing duty to provide care in that situation. Emergency care examples. Providing CPR at a motor vehicle accident scene. Assisting with medical emergencies in public places. Helping during natural disasters or mass casualty events. Providing first aid when off duty and not at work. Summary and professional accountability. Legal responsibilities include following state laws, facility policies, and ethical principles consistently in all nursing practice. Nurses must protect patient rights, privacy, and safety while maintaining accurate documentation for legal protection. Avoiding negligence and malpractice requires following best practices and staying within defined scope of practice. Reporting requirements override confidentiality in specific situations involving abuse, neglect, and safety concerns. Key takeaways for practice. Legal compliance protects both patients and nursing professionals. Documentation serves as evidence of appropriate care provided. Scope of practice varies by state and must be understood completely. Professional accountability includes continuous learning and competent practice. Thank you for learning about legal responsibilities in nursing. Your understanding of these requirements ensures safe, ethical, and legally compliant patient care while protecting your professional practice.